This presentation will discuss the roles of both palliative care and hospice care at end of life. Many times when people hear the word hospice, they automatically associate it with death and do not wish to discuss it as a treatment option. However, hospice is not about dying, but about living, and living as well as you can. Hospice care falls under the umbrella of palliative medicine. The most important thing that palliative care and hospice care have in common is taking care of people who are dying. Generally, a person is eligible for hospice services when a terminal prognosis is made with a life expectancy of less than 6 months. Eligibility for palliative care has no such time constraint, and in fact, the earlier it is started, the better. End-of-life care refers to the kind of care a person wants when they know they are dying. At such times, the people providing your care should ask you about your wishes and preferences, and take these into account as they work together with you to plan your care. They should also support your family and other people who are important to you. You have the right to express your wishes about where you want to receive care and where you want to die. You are entitled to continued, high-quality care as you approach the end of life. Advanced care planning helps to get goals and plans for treatment and can begin at any point in a person's life, regardless of his or her current health state. Ideally, it is documented in an advance directive or recorded in the medical record. It should be revisited periodically and may need to be more specific as the person's health status changes. Hospice care focuses on caring, not curing. The goal is neither to hurry the process of dying nor to postpone the inevitable. If a patient's condition improves, hospice care can be discontinued and active treatment resumed. Choosing hospice care does not mean giving up. It just means that the goal of treatment has changed. Palliative care also does not focus on curing disease. Rather, it attempts to make the person as comfortable as possible by managing pain and other distressing symptoms. It also involves psychological, social, and spiritual support for the person and the family. It is called a holistic approach because it treats the patient as a whole person. Palliative care is not just for the end of life. You can receive palliative care earlier in your illness while you are still recovering and receiving other therapies to treat your condition. Advanced care planning is a communication process wherein people plan for a time when they cannot make decisions for themselves. It includes reflection, deliberation, and determination of a person's values and wishes or preferences for treatment at the end of life. The nursing intervention chosen for this discussion is to encourage patients to identify desired end-of-life choices based on an increased understanding of the role of palliative and hospice care. The first goal is to create a shared understanding among patients, families, and healthcare providers regarding what care choices are important to the person. Patients with long-term and/or terminal illnesses have often lost control over many things. Advanced care planning gives patients back some control over their life and lets them decide how they want to be treated when seriously ill and facing a poor prognosis. The second goal is to identify a healthcare proxy who will make decisions for you if you get to the place where you are unable to. Your healthcare proxy does not have to be a medical expert, but they do need to be able to apply your general values and desires to specific circumstances in order to make decisions that are consistent with your expressed wishes. 60% of Americans report that they want their wishes respected at the end of life. 70% of those Americans have not completed an advance directive, and 80% of those diagnosed with a terminal illness want to have an end-of-life conversation with their physician. Bridging this gap between the percentage of people who want their wishes respected at end of life and those who actually have taken steps to make sure that happens is an important task for healthcare providers. Starting the discussion is not always easy, even for those in the healthcare field. One program that makes this process easier and simpler is called 5 Wishes, created by the nonprofit organization Aging with Dignity. It is an easy-to-use, advanced directive tool that asks simple questions written in plain, easy-to-understand language to help a person think about important end-of-life issues. The 5 Wishes document is written in a way that people can understand. It does not have a lot of medical jargon. It simplifies the whole process by dividing the advanced care planning into 5 steps or wishes. Wish number 1 assesses who the patient wants as their healthcare proxy. It explains who can serve as a healthcare proxy and what their role would be. This form lists 10 specific responsibilities and allows the patient to cross out anything they do not want the healthcare proxy to be able to do. Also, there is a place to add any specific things or limitations you want to place on the healthcare proxy. The second wish addresses how you want your healthcare proxy, family, doctors, and other care providers to respond in 4 particular situations. Number 1, when you are close to death. Number 2, when you are in a coma and not expected to wake up or recover. Number 3, when you have permanent and severe brain damage and are not expected to recover. And number 4, when you are in any other condition where you would not want to be kept alive. The third wish lets you choose the ways you want to be cared for and comforted. It lists such things as not wanting to be in pain, putting a cool cloth on your head if you have a fever, keeping your lips and mouth moist, having a warm bath and receiving personal care, having favorite music played, and having religious readings or poems read aloud to you when you are near death. You can cross out any of those you do not wish and add others that you do. The fourth wish addresses such things as who you want with you when death is imminent. If you want them to talk to you or hold your hand. If you want members of your faith to come to visit. If you would like to have pictures of loved ones nearby. And if you want to be able to die at home, if that is possible. And the last wish addresses what you want others to know. Things such as forgiveness, respect, how you want to be remembered. It includes information about how you want your body to be dealt with after you die and what arrangements have been made. The 5 Wishes document is legally binding. Your family and anyone who provides healthcare services for you should have a copy. Keep the original document in your home in a place where someone can find it when you need it. There is a special card to fill out and carry in your wallet, which lets medical personnel know that you have a 5 Wishes directive, who your healthcare proxy and primary care physician are, and also where the 5 Wishes document is located. Here are some of the comments that have been made by people who have used the 5 Wishes. It will be a year since my mother passed on. We knew what she wanted because she had the 5 Wishes living will. When it came down to the end, my brother and I had no questions on what we needed to do. We had peace of mind. I must say I love your 5 Wishes. It's clear, easy to understand, and doesn't dwell on the concrete issues of medical care, but on the issues of real importance, human care. I don't want my children to have to make the decisions I'm having to make for my mother. I never knew that there were so many medical options to be considered. Thank you for such a sensitive and caring form. I can simply fill it out and have it on file for my children. If you wish to purchase a copy of the 5 Wishes document, you can call the toll-free number or visit the Aging with Dignity website. You can also create your 5 Wishes using their online program. The 5 Wishes can be customized and branded for use in businesses, colleges and universities, places of worship, financial planners and insurance agencies, funeral providers for pre-planning discussion with families, hospitals, physicians, and of course, hospice and palliative care organizations.